Also today, the governor announced hundreds of people will soon be trained in contact tracing to help our state identify who may have had COVID-19. News reporter Adam Reif live in the newsroom to explain how this process will work.
The governor says contact tracing is one of the strongest weapons the state has in the fight against the coronavirus. Dr. Amy Acton not at the state's daily media briefing today, but Dr. Mark Hurst, the health department's medical director, was there. Dr. Hurst explained the fundamentals of contact tracing, explaining that anybody who believes they may have the coronavirus should first contact their healthcare provider, then isolate themselves. If a test comes back positive, they're to have no contact with family or friends. And after that positive result, a healthcare worker will contact them for an extensive phone interview. That takes roughly 30 to 45 minutes, in which they'll be asked who the infected person had been in contact with, not just while feeling ill, but in the 48 hours before becoming ill. The amount of risk to those people depends on how close the infected person was to others and how long the exposure lasted. If close contact is determined, the healthcare worker will then reach out to those people and notify them of the need to self-quarantine and monitor symptoms and temperature twice a day. Dr. Hurst says the response so far has been outstanding.
I think most people know they want to protect themselves, but they want to protect their family, their friends, their other loved ones, and other ones in the community. I checked with our legal counsel just earlier today about how many circumstances there had been where we had concerns about people not doing it. And she said really less than 10 or so out of all of those 15,000 contacts that have been in place.
So in the effort to beef up those capacity, Governor DeWine says 1,750 people will be trained in contact tracing measures. In the newsroom, Adam Reif, 5 on 2.